Hello, everybody. This is Gary. Today is Monday, December 2nd, 2023. It is 1:59 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Today, my symptoms are not that bad. My paranoia levels are pretty low. My delusions are not that strong. My auditory hallucinations are not that intense. My depression is not that severe. I'm seeing my new therapist tomorrow for the second time. I had to change therapists because the therapist I've had for the past year is moving on to an inpatient job in drug rehabilitation. So she's taking on a new job at a different clinic or hospital. And so I have a new therapist, and tomorrow I'm meeting with her for the second time. On Friday, I'm meeting with my psychiatrist. I've been seeing him about once every 4 to 6 weeks. But I have an appointment with him on Friday, and I don't suspect we'll be changing any medications or anything like that. I'm not having any side effects of my medications. I'm certainly not going to ask for an increase in my Klonopin. I think I've gone as high as with the Klonopin as I want to go, which is half a milligram 3 times a day. I don't want to go to 2 milligrams. History has shown me that if I go to 2 milligrams of Klonopin, that's where dependence and addiction start to set in. I always take the Klonopin with the Zyprexa, which is for the paranoia, delusions, and hallucinations, because it helps me relax more when I use both drugs together. But like I said, meeting with my psychiatrist on Friday, I don't suspect we're going to be making any medication changes. And the week after that, I'm seeing my peer support specialist. She has not changed. I still have the same psychiatrist and the same peer support specialist. A peer support specialist is a person who has a mental health diagnosis and works as a counselor on staff at the clinic that I go to, and I will be seeing her next week. So I still have 2 familiar faces to work with and one new one to get used to. I'm not sure how often I will be seeing my new therapist. Winter is a tougher time for people with mental illness, or at least some of us. For me, my depression gets more severe. My anxiety levels go pretty high. I feel less motivated to do things like my walking exercises and my physical therapy exercises, or just doing simple stuff like cleaning my apartment. The winter provides a whole bunch of challenges in my motivation. It tends to make my negative symptoms of schizophrenia even worse. Negative symptoms of schizophrenia are symptoms that take something away from your personality, like motivation, excitement, ambition, that kind of thing. But my depression, my anxiety, my auditory hallucinations, my paranoia, my delusions all tend to get worse during the winter, partly because my physical symptoms get worse during the winter. I had knee surgery on May 13th. The pain in my right knee tends to get worse, and my leg feels more stiff during the winter. The arthritis in my upper and lower back tend to get worse during the winter. I'm taking a few different medications that are not opioids for pain. I take the antidepressant Cymbalta for pain, Neurontin for pain, Tylenol for pain, ibuprofen for pain, and Flexeril for muscle pain. I think that I have fibromyalgia, although I've never received that diagnosis. But I am on Cymbalta for pain, and Cymbalta has been approved by the FDA for treating the pain of fibromyalgia. But like I said, I haven't talked to my primary care provider yet about that, about what, if any, diagnosis I should have. As far as my physical symptoms, I was having severe nerve pain, and that's why I started taking Cymbalta, and most of that pain has gone away. it really has helped. Whether I have fibromyalgia or not, the pain was there and it's gone now. So the Cymbalta must be doing something. And I also noticed that since I started taking Cymbalta, I'm having less of a problem with insomnia caused by depression and anxiety and panic attacks. Cymbalta is an antidepressant, and it can certainly help with anxiety, sleep, depression, that kind of thing. And I think that's why I'm sleeping better over the past 12 months or so. Last night I happened to get up very early. It was about 4:30 in the morning, and I've been up since pretty much since then. But that might be due to the fact that I went to bed early. So if I go to bed early and fall asleep, then I'm going to wake up earlier in the morning. So I did get some sleep, but I think I went to bed too early. Insomnia tends to make my problems worse. My auditory hallucinations get worse. My depression, paranoia, delusions all get worse. Anxiety levels shoot up. So, but there's not much else really to report on. Like, comment, share, and subscribe.